Digital education for all. Development of technology-enhanced learning for unemployed persons. The content of this publication reflects the views only of the author, and the Commission cannot be held responsible for any use which may be made of the information contained therein. Development and implementation of non-institutional social services. Žena. This course consists of who is and what does a caregiver do, health and social institutions, tasks of caregivers of disabled and elderly users in out-of-institutional care, organizing food, observation of users and patients, complications of long-term rest, user position in bed, transportation of patients and users, use of orthopedic aids, basic principles of caregiver professional behavior. Chapter 1. Who is and what does a caregiver do? A caregiver is a person who helps elderly and infirm people in carrying out activities of daily life and carries out basic procedures in the field of personal hygiene. The scope of work of caregivers takes place through the form of care in institutions and non-institutional help and care services in the user's home. Scope of caregivers in institutional care. Teamwork is very important. Assistance to limited mobility, immobile, incontinent people, and people with special needs in maintaining personal hygiene and meeting basic needs. First, assistance in performing the user's personal hygiene. Second, help with dressing and undressing of patients. 3. Help with feeding the users who has no difficulty with swallowing, chewing, and breathing. 4. Maintenance of hygiene around the patient user. 5th, maintaining the hygiene of the patient's bed, setting up and changing the bed. 6th, bed changing for the incontinent user. 7. Care of the user's personal belongings. 8. Accompanying the user to diagnostic and therapeutic procedures. 9. Implementation of preventive measures to prevent complications of long-term rest, pressure ulcers, thrombosis, respiratory complications, fainting, and contractures. 10. Observation of user changes and timely notification to the medical staff. 11. Care of the dying and procedure with the deceased. 12. Performance of the other tasks by order of the professional team. 13. Keeping work documentation. Scope of work of caregivers in out-of-institutional care services of assistance and home care. First, maintenance of personal hygiene of mobile, less mobile, and immobile users. Second, prevention of complications of long-term rest according to the nurse's work order. Third, preparing and serving food according to instructions and assisting with the user's diet. Fourth, maintaining the hygiene of the living space. Fifth, assistance with movement and use of orthopedic aids. Sixth, procurement of household goods. Seventh, control, procurement, and care of regular medication for chronic users. 8. Maintaining documentation on user care. It is characteristic that in non-institutional care, the caregiver's place of work is the house or home of an infirm or elderly person. Physical appearance and behavior of caregivers. Body hygiene is the basic concern of every person, especially caregivers. Personal hygiene is a reflection of its culture and creates additional trust in users. People who work with users should perform body hygiene every day so as not to introduce an infection into user's house and thereby worsen his health condition. In addition, with our appearance, we present ourselves as a person who takes care of himself and is thus ready to take care of the user's hygiene and on the hygiene of the space in which the user is located. With our external appearance, we visually communicate with the environment, and what others see is accepted as an image of us as a professional who is part of the image of the institution he represents and the reflection and mirror of the profession we work in. Taking care of personal hygiene and the personal appearance is an integral part of business etiquette. Appearance and hygiene of caregivers. Hair. It must be clean. Long hair must be tied at the nape of the neck or arranged in an unbothered hairstyle. There can be no decorations in the hair. Protect your hair best with protective caps. Ears. Ear hygiene shows the image of tidiness. The earrings you wear while working must not be offensive. Additional jewelry is not desirable. Nose. Disposable paper tissues must be used for nasal cavity hygiene. Do not touch the tip of the nasal mucosa with your fingers. Teeth. Healthy teeth have an aesthetic effect and protect the body from the consequences of diseased teeth. Teeth should be properly and regularly maintained to prevent bad breath. Makeup. A person who works with infirm and elderly uses moderate makeup. Hands. They should be monitored after each work performed, before and after access with the patient or user. In this way, we prevent the transmission of the causative agent of the disease from patient to patient or from the environment to the patient. We also wash our hands for personal protection. Nails on the arm and legs must be properly trimmed for easier hygiene and to prevent the possibility of injuring the users while working with them. Body. We will need to take a shower before going to work, and if working conditions allow, also take a shower before leaving work. Use of deodorants or other scents. Desirable because they reduce the secretion of sweat glands and neutralize unpleasant odors. Protective clothing or dress code. Each institution or association has a dress code. In the chapter 2, we will talk about health and social institutions. Social care institutions are Croatian Institute for Social Work, Center for Social Welfare, Home for Social Welfare, Center for Assistance and Care, and CSO. Retirement home. It is characteristic that in non-institutional care, the caregiver's place of work is the house or home of an infirm or elderly person. Retirement home provides hotel and stationary type accommodation. Organizes healthcare, medical and nursing care, rehabilitation, contact with psychologist and social worker. Provides all-day dining services, possible use of physical and occupational therapy hall, library, reading room, hairdressing salon. Organizes social gatherings, excursions, social celebrations, occasional cultural and artistic events, and exhibitions. Organizes the gathering of users in various groups, musical, singing, art, ecological. Holds meetings of residents of the home, therapeutic community, and lectures on various topics. A hospital is a health institution that provides health care to patients, including diagnostics, treatment, health care, and patient rehabilitation. CSO organizes and provides services in the field of non-institutional care. Caregiver tasks in institutional care. Maintenance of hygiene in the patient rooms. Patient rooms must always be neat and clean. After cleaning and tidying, the patient's room should be ventilated and the beds and nightstands should be disinfected. Leftover food should be removed from the patient's room after finished meal. Patient rooms are cleaned daily, bed linen is changed daily, in exceptional circumstances more often. The head nurse takes care for the order and cleanliness of the rooms and all premises. Maintenance of technical standards of patient rooms. Technical norms mean the temperature in the room should be between 18 and 20 degrees Celsius during the day. The temperature in geriatric wards is 22 degrees Celsius. Air humidity should be between 30 and 60%. The patient's room may only have basic furniture, namely a patient's bed, bedside table, small table, 1 or 2 chairs, a small table for serving food and coat hanger. Hospital bed consists of metal structure, soft parts, and bed linen. Today's standards of treatment and care require the use of special beds. A good choice of bed can greatly affect the condition of the patient user as well as the very efficiency of the service provided to him. Hospital beds can be beds for standard or minimal care, beds for semi-intensive care, beds for intensive care, beds for retirement homes and home care, other beds, beds for dialysis, beds for children's departments, or beds for newborns. The common characteristic of all special bed is that the headboard and other parts of the bed can be adjusted according to the needs of the user. The caregiver's scope of work includes setting up beds with and without patient or users, changing the bed with and without patient or user, setting up and changing the bed with the patient or user in the supine position, setting up and changing the bed for the patient user in elevated position, setting up and changing the bed of an immobile incontinent patient or user. The procedure of changing and making the bed consists of preparation of patient or user, explain the need to perform the procedure, adapt procedure to the condition and mobility of the patient or user. Preparation of changing trolleys, sufficient number of clean sheets and impermeable sheets for incontinent patients or users. Preparing a basket for dirty linen. Use of disposal gloves when working. Procedure for setting up and changing the bed. The bedding is released from the footboard towards the headboard. Pillows and blankets without covers are placed at the foot of the bed on the accessory provided for that. It must not be shaken or dusted with covers and pillows in the room. The freed linen is rolled up and thrown into the dirty linen basket. Turning the mattress is important. Arranging the bed starts from the footboard towards the headboard in order: bottom sheet, top sheet, cross sheet, and cover with the blanket, pillows, and pillowcases. It is important to tighten the bedding well so that it's wrinkle-free. Setting up and changing the bed of an incontinent patient or user is the same as described above, but except that an impermeable sheet should be also prepared in the bed equipment. Between making and changing two or more clean beds, it is necessary to disinfect hands or perform hygienic hand wash. Hygiene includes general and practical procedures that ensure the cleanliness of the users and the space in which he stays. Hygiene, clothes and shoes belong to the narrower area of personal hygiene and are very important for maintaining personal hygiene with the aim of preserving health. The purpose of personal hygiene is to maintain healthy and clean skin on the surface of the body that can perform its normal function. Clothes and shoes will be best serve the purpose if they are made of high quality and natural materials such as wood, cotton, silk, leather, and are used in accordance with the weather and seasonal conditions, and the size and the cut match the person being cared for. In the chapter 3, we will talk about tasks of caregivers of disabled and elderly users in out-of-institutional care. In this form of care, the caregiver provides services to the user in his own home and at the same time takes care of the user and the hygiene of the user's space and residence. Caregiver services in non-institutional care are maintenance of personal hygiene, maintaining the cleanliness of the premises and clothing, procurement of necessary foodstuffs and other necessities, procurement of control of medication intake, assistance with meal preparation at the user's home, accompanying the user when going to the doctor, payment of bills and other administrative obligations provided by user, psychological support. Personal hygiene is a term that refers to the hygienic procedures that a person applies when maintaining personal cleanliness. When we talk about the personal hygiene of the patient or user, we mean maintaining the cleanliness of the body and the environment in which the patient or user is located. It is important to maintain personal hygiene because of increasing the body's resistance and protection against infection, maintaining the proper function of skin organs and visible mucous membranes, preventing complications from long-term rest, raising the psychological condition of the patient or user. Division of the personal hygiene. We divide personal hygiene into daycare, which consists of morning and evening brushing teeth, washing up to the waist, washing genitals and combing. Partial care, which consists of brushing teeth, washing hands, combing, washing feet, washing genitals for the incontinent patients or users. Occasional care, which consists of bathing the patient in bed or bath, showering and washing hair. Technique of bathing the patient or user in bed. Bathing patients or users in bed is a personal hygiene procedure that is carried out for immobile patients and users. The procedure of bathing the patient in bed is carried out in such a way that it is individually adapted to the needs or health condition of the patient or user. Preparation for the procedure is important before any procedure. The patient or user preparation. The preparation and planning of the bed is carried out by nurse and consists of checking the vital functions and talking to the patient about the procedure, and the caregiver participates in the preparation and procedure. Preparation of the room, heating and screen protection if the patient user is in multi-bedroom. Preparation of the mobile chair for care. The upper surface consists of accessories for oral cavity care, disposable cup with lukewarm water, toothpaste and toothbrush, kidney bowl disposable or stainless steel sterile, cells, disposable paper towels for persons participating in care, 2 towels for wiping the patient or users, disposable swabs, disposable gauze. Sterile stainless steel screws, sterile nail clippers, washing agents and massaging lotions, disposable latex gloves, comb, 2 jugs with hot water or cold water according to the wishes of the patient or user. Middle surface consists of clean and folded bed linen, sheet folded into a long or short roll, transverse sheet, prepared impermeable canvas, cover and pillowcases. Lower surface, renal pelvis, folded sheet with impermeable canvas, protective rubberized sheet or disposable compress. Canister for draining water if the sanitary facility is far from the location of the procedure. Performance of procedure. First, bring a mobile table and a trash can. Second, brush the patient's teeth. Third, release the bedding or cover. And fourth, remove the pillows or leave them as needed by the patient and user. Fifth, take out the blanket from the sleeve. Sixth, protect the bed with impermeable canvas and sheet if the mattress itself is not protected by the same. Seventh, take off the patient's nightgown or pajamas. 8. Monitor and clean the patient in the following order: oral cavity and washing teeth, eyes, ears, face, neck, chest, abdomen, arms, back, legs, genitals, and at last anal area. In the ninth step, we will remove the impermeable canvas and change the bedding. 10th, dress the patient or user if necessary and earlier according to the washing stages. 11th, comb the hair. 12th, unpacking the patient's room and accessories. Maintaining the hygiene of users' underwear in non-institutional care. Underwear, which is the most polluted by sweat, grease and dust, should be washed regularly in order to keep the skin healthy and thus enable normal ventilation of the body. Underwear must be boiled in order to remove all impurities and at the same time to destroy numerous bacteria, which multiply in impurities and can cause various separation and inflammations on the surface of the skin. By washing and boiling the laundry, possible pests which may be found in the laundry, as well as their eggs and larvae, are destroyed. If possible, the laundry should be dried in the sun and then ironed well, because this ensures its cleanliness even better. Maintaining the hygiene of the outerwear. Outerwear should be clean, and we achieve this by washing it occasionally, but also by regularly brushing, airing, and sunning it. Unclean clothing also prevents airing and evaporation of the body, and this is especially true for the impregnated and rubber clothing, which should be worn only when it has to protect us from the external moisture, and should never serve as a permanent item of clothing. Task of caregivers when exposure of user to weather condition is imminent, hot or cold. Going out in the cold should be avoided. However, when going out, it is recommended to protect the head with a hat, hands with gloves, and cover the mouth with scarf, in order to prevent direct inhalation of cold air. Warm and comfortable shoes without high heels are important. If you notice increased sweating, it is necessary to immediately change the wet clothes that cause heat loss, and also to free the elderly person from excess clothes. Elderly person must not be exposed to solar energy in the summertime in period of 10 to 17 hours, especially not elderly heart patients or geriatric patients suffering from diabetes. When leaving their residence, an elderly person must necessarily protect his head with hat. The clothes should be layered and not too tight. The outer layer impervious to wind and moisture, preferably clothes made out of wool, polypropylene, and silk that retain more heat in the inner layers. Housing hygiene. Apartment cleaning is one of the prerequisites for maintaining health in the environment where a sick, infirm, or elderly person resides. Impurity favors the growth and reproduction of microorganisms, many of which can cause disease. With proper cleaning guidelines, we reduce the number of microorganisms to an acceptable level. Caregiver tasks in maintaining the hygiene of the user's apartment. Everyday affairs, making beds and bedding, airing, cleaning clothes, vacuuming, washing dishes, dusting, cleaning bathrooms and toilets. It is important to create a cleaning plan. Firstly, what to clean. Everything that comes into contact with the user, the immediate environment where the user resides, the area for preparing and consuming food, and the area for maintaining hygiene. Second question is how to clean. Pay attention to the order of cleaning, from less impure surfaces, objects and spaces to more impure surfaces, objects and spaces. Which chemical agent is used? Dosing method, certain concentration, required contact time of action, temperature of the solution, method of applying the agent, operating instructions for the equipment and accessories. And the third question is when to clean. During work, after soiling, and between different work processes. Disinfection methods used by caregiver in the user's home. First, we have mechanical methods. Brushing, scraping, scrubbing, sweeping, ventilation, or airing. Second, are thermal methods. Cleaning with hot steam, ironing clothes, and bed linen. Third, we have application of chemical agents, detergents, and disinfections. Detergents are agents that are used to remove grease, impurities, and partially mechanically remove microorganisms. Disinfectants are means that reduce the number of microorganisms on a surface or object to the amount that is not harmful to health. Method of application: wiping, washing, dipping, and spraying. There are products on the market that contain both components and are used simultaneously for washing and disinfection. Chapter 4: Organizing Food. Tasks of caregivers at the organization of nutrition and nutrition of patients or beneficiaries. Nutrition is an important factor in maintaining health. With food, we introduce the necessary nutritional substances into body that ensure a healthy life for the user. Organization and distribution of food in the institution. It is necessary to provide prerequisites such as: first, clean and tidy dining room. Second, ensure enough space at the table and a sufficient number of chairs. Third, provide the required number of mobile tables. Fourth, place the patient in the appropriate position. Fifth, wash the hands of the patient or user before eating. Sixth, caregivers must put on protective aprons and gloves before feeding. Seventh, when collecting and distributing food on the ward, the child must be watched and the user's identity must be checked before serving. Eighth, feed the immobile in bed. Ninth, check how much the user is eating and whether he or she is taking in enough fluids. Then, after the meal, take out the tray. 11. Allow immobile people to wash their mouths and teeth. 12. Ventilate the room. 13. Make the patient comfortable in bed after meals and allow him to rest. How can a caregiver improve food intake with the elderly and infirm? Firstly, find out the user's habits, time and number of meals, what the users like and dislikes to eat. Second, provide meals always at the same time. Third, when feeding, place the user in the most comfortable position possible. Fourth, always feed him in the same place. Fifth, if the user has a prosthesis and is afraid to use it, encourage him to use it. Sixth, wash his teeth and oral cavity before and after eating. 7. Ensure suitable temperature of food and sufficient amount of water. 8. Bring food neatly served on a tray. 9. Cut food into smaller pieces for the patient. 10. Wash the user's hand before feeding them. Organization of nutrition in extra-institutional care. The caregiver must ask about dietary restrictions, diet caused by a medical condition. The carer must know the customs and eating habits of the user. In accordance with the state of health and customs, obtain food and help prepare cooked meals. Clean the kitchen and wash the dishes after the meal. The caregiver is also obliged to take care and keep records of fluid intake for 24 hours, minimum 1,500 milliliters. Offer him drinks every few hours during the day. Monitor the color and amount of urine. Intense yellow to orange color indicates insufficient fluid intake. Monitor regular bowel movements. Dry and hard stool indicates already present dehydration. Provide suitable cups or glasses that are not too big or too heavy for the user. The drink offer must be at optimal temperature. It is important to remember that the coffee has a diuretic effect. In order to detect dehydration in time, it is necessary to monitor the turgor of the skin and the condition of the mucous membranes. Monitor breathing. Increased breathing indicates dehydration. It is necessary to weigh the user daily at the same time and on the same scale. Chapter 5. Observation of users' patients. In elderly people and during illness, specific and non-specific symptoms and signs appear that the caregiver must notice as a change in the user's conditions. Illness can trigger the appearance of the problems related to meeting the patient's user's basic needs by visually, olfactory, auditory, and tactile senses. The observer obtains information about various aspects of the patient's condition and environmental influences. The observation is influenced by the objective situation of the caregiver who assesses the user's condition based on sensations, Patient or user observation is one of the user data collection techniques used by caregivers to assess the user's current condition. The purpose or goal of observing patients, users, is to gain insight into their psychophysical condition. The caregiver must know the appearance and functions of the user as whole in order to be able to assess whether there is a deviation from normal. Observation must be carried out comprehensively, systematically, and constantly during each stay with the patient. Observation must cover the patient from head to toe, and observation should include the condition, behavior, and appearance of the patient. Characteristic of secretions and tasks of caregivers. The caregiver must monitor and record amount of appearance of secretions. Firstly, we will mention urine. When urinating, urine is excreted, which removes unnecessary and harmful water-soluble substances from the body. Urine examination assesses the state of the kidneys and other organs that affect metabolic functions. Here are some common terms for pathological changes in urine. Hematuria, which means blood in urine. Then we have macrohematuria, which represent blood that is visible in the urine without any aids. Thirdly, we have nocturia or nocturnal urination. After that, we have retention, stagnation of urine in the bladder due to obstruction in the outflow. Next, we have oliguria. Oliguria represent reduced urine production. Next, we have polyuria. Polyuria is a state where increased production of urine is visible. And lastly, we have incontinence, uncontrolled urination, inability to hold urine. The patient or user can urinate spontaneously in the toilet, in the night container, in diapers, or using a urinary catheter. Caregiver tasks. To ensure user's privacy when urinating, place the user in a suitable position. Heat the overnight container. The use of warm compress in case of difficulty urinating relaxes the abdominal musculature and improves urination. Stool or feces is the common name for waste products of digestion. Feces contain indigestible food residues, water, bile pigments, and microorganisms. Defecation, the very act of eliminating contents from intestines. Stool emptying is regulated from the center in the spinal cord. Good peristylse of the large intestines also affects regular bowel movements. Here are the terms we use for changed characteristics of stool or the feces. Melena, which represent black tar-like stool, appears as a result of bleeding in the upper part of digestive tract. Next we have diarrhea, the appearance of frequent liquid or soft stools. And lastly, we have constipation. Stool retention is a rare and irregular bowel movement, once in more than 3 days. Caregiver tasks when controlling constipation in disabled and elderly users. Ensure a suitable environment and privacy in case of defect. Change diet, more vegetables, fruits, and drinks. Strengthen intestinal peristalsis by performing exercises and establishing a regular time for defecation, preferably 20 to 40 minutes after meal. The urge to defecate occurs 30 minutes after meal, so the user is prepared for defecation. Encourage squatting and walking exercises according to the user's functional ability. Next, we will have cough up. Cough is a voluntary or reflex reaction, sudden or noisy, serves to eliminate secretions from the lower respiratory tract. Sputum from the lower respiratory tract contains mucus, epithelia, cells, foreign particles, sometimes pus, leukocytes, bloods, etc. Here are the forms of cough. Hematopoeia. Coughing up large amounts of blood, bright and frothy. Hematopsis, admixture of blood in the sputum. When coffeous blood is coughed up, the patient is at risk of death due to suffocation or bleeding. Here are the caregiver tasks for cough-ups. Put the user in an elevated position or position where the stimulus is the least. Remove external irritants, dust or smoke. Offer hot beverages. Provide optimal microclimatic conditions in the room where he stays, warmth and humidity. Provide the user with equipment for expectoration within easy reach, paper towels or an expectorant container with lid. Regularly empty, wash and disinfect the container for collecting sputum. Vomiting and vomited mass. Vomiting is a reflex phenomenon that occurs due to stimulation of the vomiting central located in the extended spinal cord. Causes are digestive, changes in the central nervous system, endocrine, circulatory, or metabolic. Vomiting is preceded by nausea, and this manifests itself in the patient being pale, sweating, burping, or increased salivation. Characteristics of vomited masses. The amount varies with food or other stomach contents. Content of stomach can be food, medicine, mucus, or parasites. The color depends on the food consumed and admixture of bile. Blood is fresh, partially digested, dark to brown to black, hematemesis. Caregiver tasks. It is necessary to prepare the necessary accessories in time. Lay the patient on his side or sit, clean the basin or renal pelvis, a tissue or a clean towel. A glass of water for mouthwash, change clothes if necessary. Sweat represents a clear salty liquid produced by the sweat glands. Characteristics of the sweat are: it consists of water, electrolytes, and unnecessary and harmful products. Acidic reactions, about 600 milliliters of sweat, is secreted during the day, and it is important regulator of body temperature. Caregiver's tasks. Remove sweaty personal underwear. Personal hygiene, wipe the body with disposable cloth and water and dry the body. If necessary, change personal and bed linen. Fluid replacement by mouth or in case of signs of dehydration, alert the professional services to include fluid replacement by infusion. It is very important to remember that any occurrence of blood in exertions, urine, stool, vomitus or sputum should be immediately documented and professional staff notified. Chapter 6. Complications of long-term rest. First is decubitus, which is localized damage to the skin or subcutaneous tissue, which can involve muscles and bones and is caused by pressure and friction. Here are the tasks of caregivers in preventing decubitus in disabled and elderly users. Examine the skin at least once a day. Bat the user to improve circulation in exposed areas, sacrum, heels, and elbows. Prevent skin dryness. Change position of the user every 2 hours. Use special mattresses that contain foam, gel, air, or water. Keep the headboard elevated most of the time. When sitting on a chair, change position every hour. Use washers or pads. Avoid round pillows with a hole in the middle. Place a pillow under the legs of immobile users, under the lower leg and heel to keep them away from the surface. Advise the user who can move to change position every 15 minutes. Using a pillow between the legs to prevent touching the knee or ankle is advisable. For incontinent patients, clean the skin after moisturizing. If incontinence is more difficult to control, absorbent pads with quick drying surface are used. Inflammation of the walls of blood vessels or thrombophlebitis. It occurs as a result of accumulation of platelets, fibrin, and erythrocytes in the blood vessels. The result of this is the formation of clot thrombus, and the vein wall becomes inflamed and thrombophlebitis occurs. The skin in the area of inflammation is red and painful, and there is a risk of thrombus breaking off and clogging vital organs with clot, which can lead to pulmonary embolism and death. Caregiver tasks in the prevention of thrombosis. Measures to prevent thrombosis are aimed at improving circulation, and we achieve this through early mobilization of patient's users by getting out of bed as far as his health condition allows. Correct position and frequent changes of position in bed. Active and passive exercises in bed. Deep breathing exercises. Lying on back with the foot of the bed raised. Putting on elastic stockings and bandages before getting out of bed if patient has varicose veins on the lower extremity. Caregiver tasks for the patient users with signs of thrombosis. The patient user must rest in bed for 10 days. Getting out of bed is strictly forbidden. Patient personal hygiene is performed in bed with minimal activity. Psychological needs are performed by the patient or user in bed. The deceased extremity is placed in an elevated position using a pillow. Cold compresses are placed on the extremity. Dormancy lasts approximately 7 to 10 days. Respiratory complications. Respiratory complications occur in patients as a result of long-term rest and due to reduced ventilation of the lungs or stagnation of secretions. It can lead to respiratory infections, bronchitis, or pneumonia. Caregiver tasks in preventing respiratory complications. Correct position in bed, semi-sitting, and change of position. Breathing exercises. Expectoration. Maintaining personal hygiene. Contracts. A contractor is a limited joint mobility in one or all directions. Tasks of caregivers in prevention of contractures. Firstly, place the patient or user in the correct so-called physiological position. Carry out active and passive exercises of muscles and joints. Faint or collapse. Fainting or collapsing is a short-term loss of consciousness, often occurring in a patient who lies down for a long time and then suddenly gets up. Caregiver tasks in preventing collapses or faints. Changing position in bed regularly. Assistance to the patient when standing up for the first time. What to do in the case of fainting. It is important to lay the patient or user on the floor or bed in the autotransfusion position, which is raised lower extremities. Falls regarding elderly. Falls are the leading cause of injury and death, especially in the elderly population. Falls can cause physical and psychological consequences. The physical consequences of a fall are injuries such as femoral neck fractures, fractures of other extremities, traumatic brain injuries, etc. Chapter 7. User position in bed. The user can take an active, passive, or forced position in bed. Active position represents the patient getting into bed and taking positions independently without the help of another person or aid. Passive position. The patient in bed cannot take a position independently, but is partially or completely dependent on the help of another person and aids. And forced position. Taking this position is conditioned by the consequences of the disease or is medically indicated for diagnostic and therapeutic purposes. Here are the forced positions of the patient. Fowler's position or semi-sitting position. We achieve this position with a special bed by raising the headboard as much as necessary. If we don't have a special bed, we can achieve such position with pillows by stacking them in the shape of the letter A, or strung together like roof tiles. Second is Trendelenburg's position. The position of the patient is with the head and shoulders lower than the pelvis and lower extremities, thereby achieving better circulation in the central nervous system. We put patients who have collapsed due to low pressure in such positions. We achieve it by removing the cushion and raising the base. The third forced position is called Coleman's position. The position used for injured person during transport, unconscious or in coma. And the purpose of this position is to ensure the patency of the airways and prevent aspiration. The patient is turned on his side towards the abdominal tilt, supporting him from the back with pillow and another pillow in front of the chest. The lower leg is extended and the upper leg is bent, between which there is a pillow. The upper arm is bent at the elbow and placed under his head, and the lower arm is bent under his back. Next are the orthopnoic position. The position is sitting in the bed, leaning forward. The patient sits with his feet down on the bed. This position is occupied by the patient who have heart problems and breathing problems. The person sits in the bed upright or slightly bent forward. Keeping the patient or user in this position is made possible by placing a pillow behind the back and the patient rests his elbows on the auxiliary feeding table. Position for pain in the abdominal cavity. The patient lies with the knees drawn to the chest, and in this way we reduce muscle tensions and pain. Next are the position of the unconscious patients. The unconscious persons should be laid down. Do not bend the spine if it's suspected of an injury. The head is thrown back and turned to the side, which allows breathing and the outflow of liquid from the mouth. Change of patient-user position. Transfer. Transfer implies any change in the position of the patient or users. In order to properly perform the transfer, it is important to know which position allows the condition of the user or patient, the degree of mobility, and develop technique or skill of the correct way of performing the transfer. Active position change. The patient user changes the position by himself without the help of another person, or a trapeze is used as an aid to change the position. And finally, passive change of position. He cannot change his position on his own. The patient needs the help of another person for that. Assistance of the caregiver when changing the user's position in bed. Changing position in bed from back to side. The caregiver participates in the change of position by standing on the left or right side, depending on which side the patient is placed on. If the patient next to the bed, passing the patient's left or right leg over the right or left leg. If the patient has no obstacles in terms of medical conditions or locomotor system. The caregiver grasps the left or right shoulder with the hand of the headboard, and the left to right hip with the hand of the footboard, and turns the patient or user onto his side. We often use this side of the bed or railings for position changes, which the patient user can hold on to. Next, lifting the patient or user in bed towards the headboard. Caregiver, one or more, depending on the mobility of the patient or user, who participates in the change of position by standing on the side of the bed and reaches under the patient's armpit with an arm up to the elbow. Level closer to the bed, and upon agreement 1, 2, 3 signal, pulls the patient user towards the headboard. If the patient state of health allows, when lifting with the bent knees, he supports himself on his feet. Often, when lifting a patient in bed towards the headboard, cross-bedding is used as an aid when the patient cannot due to the nature of the disease. In that case, the participation of two peoples is necessary. By agreement, at the same moment, roll up the cross sheet to the edge of the patient's body and lift it towards and headward. Lifting the patient user in bed, according to the headboard. The hardly mobile patient user is lifted towards the headboard for preparation into a sitting position by two people. Each one stands on the side of the bed. The patient's arms are crossed on the chest. The patient tilts his head forward, the legs are slightly bent at knees. The caregivers catch the patient user under the headboard with their hands under the armpits, and the hands of the legs are pulled under the glutes and together they lift it up. And lastly, lifting the patient user from a lying to a sitting position. Standing up from a lying to a sitting position is performed by from a supine position, from side positions, and from semi-sitting position. When straightening from the spine position, it is necessary to bring the pelvis towards the edge of the bed, through the bent lower extremities and support them and make the body asymmetrical towards the side over which the straightening will be performed. Chapter 8. Transportation of patients. Types of transport of patients. Lying on a recumbent trolley. Sitting with a wheelchair. Each form of transport requires the preparation of the patient and preparation of the means of the transport. Patient or user preparation for the transport. Explain the method of transport to the patient or user. Dress the patient adequately for transport. Ensure safe transfer of patients from one position to another. Help the patient or user with the transfer. Enable the participation of the patient beneficiary in the transfer as much as the patient's state of health allows. Transportation in seated strollers. Prepare the patient or user according to his status, mobile, partially mobile, or immobile. Provide a means of transport, in this case wheelchair. When moving, take care of the safety of the patient. If necessary, the participation of several people can be included. Correctly position the patient in a wheelchair. Caregiver's task when positioning the patient or user in the seated wheelchair. Firstly, ensure a sitting position that is suitable for the user's condition. The feet of the patient must be placed on the floor. Put on the slippers on the patient or user's legs. The patient must feel safe on his feet. Transportation of the patient's user from the bed to recycling cart. Prepare the patient or user for transport. Provide the means of transport, a recumbent cart. During the transfer itself, use additional aids, trapeze, cross sheet, rollboard, transglide, or a rollover. When transferring a patient to a recumbent wheelchair, the participation of 2 or more people is required. Disinfect the recumbent stroller before use and protect it with a sheet or disposable paper covers. Before the transfer, position the recumbent wheelchair next to the edge of the bed and lock it. It is also necessary to check that the wheels on the bed are locked. Raise the level of the bed to the level of the recumbent stroller. Remove bedding from the bed that can be an obstacle during the transfer. The patient on the recumbent trolley must be covered, comfortably adjusted, and ensure safe transport. In the picture 6 and 7, we can see lifts for immobile patients. Picture 8 represents bed hair washing container. Chapter 9. Use of orthopedic aids. A large number of geriatric population uses some of the mobility aids, canes and walkers, as well as other aids in accordance with physiological changes. The caregiver is obliged to help with the purchase of the aid and to educate the user about the mobility aid and help him in the using the aid. The most commonly used aids for the elderly are glasses, hearing aids, dental prostheses, canes, wheelchairs, bedding chairs, adjustable bed, insoles, geeses, lifters, bandages, or other. Caregivers must use protective equipment in their work. Chapter 10. Basic Principles of Caregiver Professional Behavior. The caregiver is obliged to maintain a correct attitude towards the user within the scope of his work, to work professionally and responsibly while protecting the dignity of the user as well as his own dignity, to communicate and cooperate within the team. Continuous improvement. Caregiver also needs to possess knowledge, skills, and abilities within their scope of work. Protect the patient from risks within his scope of work. Contribute to safe therapeutic and ethical work. Respect professional secrets. Patient information must remain strictly confidential and must not be transferred within and outside of the work environment. Thank you for listening to this course. If you feel like you've learned anything, please follow the final test.